Moment of the sexual experience will ask the young lady, who's your daddy?
This should be remixed. If Officer Akimov is watching, this could be the next remix masterpiece. Because just wait till you see what happens here. Oh, Officer Akimov is here. That's beautiful.
Who's your daddy? Who's your daddy?
Who's your daddy?
I'm joined today by Pastor James David Manning.
Who's your daddy? Who's your daddy?
No, I'm a Christian.
Who's your daddy? Who's your daddy?
Who's your daddy?
I'm joined today by Pastor James David Manning.
Who's your daddy? Who's your daddy?
A long-legged Mac Daddy is the most successful pimp on planet Earth. To reverence the Word of God, to trust it, to preach it, to teach it, loads and loads of money and tons of lives. Loads and loads of money and tons of lives.
What happened in prison that brought you to Jesus? What happened in prison that brought you to Jesus?
George Bush Sr. and George Bush Jr. have been penetrated by at least 100 men in their anus area. 100,000, 200,000 strong. I didn't do it. That's not my problem. So I got down on my knees. I didn't do it, but I was tempted.
Sounds like quite an evening.
Loads and loads of money and tons of lives. Loads and loads of money and tons of lives. Loads and loads of money and tons of lives. Loads and loads of money and tons of lives. I didn't say something to you about marketing. Starbucks has done the exact same thing that Coca-Cola has done, except they've done it with semen.
That certainly seems to be a story that has been missed. If you're just joining us, Rudy Giuliani is sweating his face off, explaining to us why Trump really won the election.
Republican inspectors. Every state. Almost every approved this. It's thrown away. Gone for eternity.
Is this a skit?
The only thing left is to have been a dead person. That could have been not filled out properly.
Wait, he's saying there was a dead person in the envelope? Rudy's about to have actual drops of sweat coming off of his brow. I mean, is this a normal amount? I don't know how hot it is in the room, but something seems very wrong here.
All be in the lawsuit that comes out tomorrow.
Rudy's melting.
Arizona is a state that we're looking at very, very carefully.
Strongly looking at it.
I would say we're probably, I assume,
God.
if she's working for the... I'd like to read them all to you, but I don't have the time. You should have had the time and energy to go look for them. That's your job. Like it's my job to defend the president and to represent the president. It's Maine, Michigan, Wisconsin, Nevada.
Is he bleeding? Did you see? Is he bleeding from his ear? What on earth was that?
Votes needed to
It's on both sides.
to find out if I'm misleading.
Is that hair dye?
Is to look at the lawsuits. In order to do it, I
It
have to
looks
get
like
permission from
blood.
people. But in the materials,
Oh my
I
God,
have
it's
here,
everywhere.
at least 10,000 at least. And we're getting more.
He's got to get off the stage.
And there are other aspects of this fraud. On the morning of November 3rd,
Someone's got to get him a napkin.
they were going to count this new kind of ballot.
God,
This
I've
mail-in
never seen
ballot.
anything like this.
Maine,
What on earth? It's getting onto his shirt
in
now.
Michigan and in Wisconsin, any jury would accept if they heard this evidence that somebody had this plan.
This is insane.
Maybe that was always the plan.
It looks like sap from an oak tree or a maple tree. It looks like someone's making syrup.
To the city describe that to you.
Oh my God, it's all over his face. He's gonna need a towel.
Dealing with
Actual evidence of
I don't know, guys. It's sounding like Trump won, isn't it, based on this? All right, welcome everybody. We have quite a day ahead of us. My main thing today is I am covering this upcoming emergency White House COVID-19 response team press briefing. A number of reporters at the last press briefing asked, why hasn't the COVID-19 team been briefing us? So the White House has responded to that, and they've scheduled a briefing for 20 minutes from now. The regular press briefing was delayed by 2.5 hours, if you can imagine that. Imagine if I had been waiting to cover that at 1 p.m. Eastern time today. That's going on, and we may look at a little bit of that in a moment. But I have so many things to cover and so many things to talk about. And we will be hearing from Dr. Fauci, who somehow he's just a doctor, but he's enemy number one for a lot of these right wingers. And we're going to be hearing from him, presumably, and many others, Rochelle Walensky, others at the top of the hour. OK, so welcome, everybody. You have missed nothing yet. The announcement has not yet happened. I do want to say thank you to Farsoth, Weatherboxer, Artistic Simplicity, and Charison for signing up at via Twitch Prime. We actually have something very special today. We have a broader goal of 100 website members and Twitch subs. If we get to 50, I will play a couple of rounds of our exclusive new game, Noam Chomsky or Bobby Fischer. This is a game that's been under development for some time. I was not going to debut it until later, until after our vacation, actually. But because the game is ready, if we were to get to 50, just halfway, I will play like 2 or 3 rounds of this game with you guys. It's a good game. It's a really good game. One of the first games we've developed, and it's very strong, very, very strong. So let's get to 50. You can use the coupon code MyHIPAA at joinpacman.com. That's not my rhino. It's not my giraffe. It's not my dog. It's MyHIPAA. That's the code, and it's got to be spelled correctly. And if we get to 50, I'll play a few rounds of that. I think people are really going to like it. I think it's going to be fantastic. Thanks to Deeper Shades of House, our friend Lars Behrenroth, for the raid with 25 people. Great to have you here. And we've got a lot of different things going on. Jay Bundy via Super Chat says that dude from the video totally looks like a senior version of Roy Wood Jr. I don't know who that is. Roy Wood Jr. Oh, Pastor James David Manning. Oh, okay. Yeah, I do see a resemblance there. Yep, I do see a resemblance. We also have potentially, thanks to Kaufdrop for the Twitch Prime sub. I also have potentially some voicemails to play for you. I'll just preview one to give you a sense of what they're like.
So I was wondering how easy the Bible makes it for another country to come in and take over.
Right.
Like just the continual praise of like that you would take in somebody else's orders.
Okay, so there's still a lot that we're still working through voicemails from the vacation at the end of June, if you can imagine that. And then also I will do unban requests. Oh, which I don't even have any to do, actually. Okay, so maybe no unban requests today. Let's get into a couple of different things that I did have. I'm going to cover this in more detail tomorrow. This is Pastor Greg Locke from the Global Vision Bible Church somewhere in Tennessee. Tennessee is very heavily infected, and he is screaming at people saying, don't get the vaccine. Check this out.
I've been right about all of it. We've been right about all of it. Woo!
He's literally doing the sermon in a circus tent.
Yes. Yes! These wicked fools don't win in the end. They don't win in the end. So all this fear bull crap is that. It is bull crap. Say amen. What? I know you've never been to a church where a pastor told you to say amen after I said bull crap.
Whoa, edgy. This guy must be saying really interesting things. Okay.
It's better than what I want to say. I call it real BS, biblical stupidity.
Oof.
Biblical stupidity. So I know I wasn't going to say nothing about it, but I think I feel froggy enough. I'm going to jump right now and just say this.
Okay. Now he's going to really talk turkey.
I am not apologizing for what I said on this platform last week.
Oh, okay.
The Delta variant was nonsense then. It is nonsense now.
There
You
you
will
go.
not wear masks in this church. You will not wear masks
This guy banned masks.
in this church. I'm telling you right now, do not get vaccinated. Do not get vaccinated. I don't care what you think about me. I don't need your money. I don't need
How would he make money from vaccination anyway? It doesn't make sense.
your hand
This guy's clearly vaccinated, right?
clap. I don't need more people on social media
Is this a stroke? Is this a medical event?
to follow me. I ain't following along with it. Joe Biden's days are numbered.
Whoa.
Said they're numbered. I've told you the whole time this election was fraudulent. We got so much proof. The only people that can deny it are crack-smoking, demon-possessed leftists.
Now, that's a church, so they don't pay taxes, right? This is such a holy place where this is going on that they have a very special relationship with the government where they are tax exempt. They receive money from their congregants and they don't pay taxes. They can own property and not, because it's a church, guys. It's a revered place of holy, right? So they do not pay taxes in the United States. Very, very important stuff. So that's really bad. Really, really bad. Aaron Washington dropping a $50 super chat, apparently on the way out of politics, maybe as a result of that video. Aaron says, "I'm sorry, David, but I've completely 100% given up on America. We are deeply divided along party lines. The rich are still hostile towards the poor and working class. There's been no meaningful action on climate change, not fixable." So Aaron's basically done. And I understand the sentiment, my friend. I understand the sentiment. It's really bad out there. Jay Bundy says, "I wanted to donate more money to show my support of the previous super chat. America is in a sad state. It's hard to be hopeful." Yes, super chats mourning America. Dariten said, "Fitting that this is happening in a circus tent." Yeah, it's all bizarre. It's all bizarre. It really is. It's crazy. Thanks to Dollar Batteries as well as Tactopus and Nuevo Leon for signing up via Twitch Prime, number 7, 5, 6, 6, 7, and 8. I do have a game to play. That game is Noam Chomsky or Bobby Fischer, Who Said It? And we were not scheduled to play this game until after our vacation, but I'll preview a little bit of it today if we get to 50. Obviously, if we get to 100, phone lines open and fireworks go off. But even if we just get to 50, we will play a little bit of this game. I think it's a great game. Really, really good game. The Jen Psaki press briefing started 2.5 hours late. So we are just kind of monitoring that because I think the COVID briefing will start right after this. So we're keeping an eye on that, although it is not the main thing today. Not the main thing today. Hi, David. When you read physical books, do you take notes or remember what you read? I don't. I rarely take notes. When I read nonfiction, I will sometimes underline, really, really strong underlining with a felt-tipped pen. With any kind of pen, doesn't really matter. Okay, so we've gotten that. Let's. Now what's Lindsey Graham with COVID? Yeah, let's look at that. So Lindsey Graham has COVID. Lindsey Graham tests positive for COVID-19. Senator Lindsey Graham of South Carolina, Republican, said Monday he has tested positive for COVID-19 despite being vaccinated. Why it matters, Graham emphasized that the mildness of his symptoms is due to being vaccinated. If he had been unvaccinated, his symptoms would be far worse, he said. That's most of what we know. Let's see what he tweeted. I was just informed by the House physician I have tested positive for COVID-19 even after being vaccinated. I started having flu-like symptoms Saturday night and went to the doctor this morning. I feel like I have a sinus infection and at present time I have mild symptoms. I will be quarantining for 10 days. I am very glad I was vaccinated because without vaccination, I am certain I would not feel as well as I do now. My symptoms would be far worse. Well, good that Lindsey Graham was vaccinated. Good that he got tested. Good that he will be quarantining. And he is advocating for vaccination. That's exactly right. In the meantime, the COVID situation in the United States is looking very, very ugly, as you can see here. We did get up over 100,000 new cases on Friday. Now, increasingly, there's the belief that cases are less relevant as more and more people are vaccinated. To some degree, of course, that's true. Unfortunately, this is hospitalizations, and those are also starting to increase pretty significantly. A little bit of a flattening, but that may have been an artifact of the weekend. But hospitalizations up about a third. And then deaths also starting to climb a little bit, but not that much. So we were down to, I guess, about low twos, and now we're back up to low threes. So we're going to keep looking at all of that. That's what's going on. And part of that is why we are expecting a briefing from the White House in about 10 minutes. Oh, yeah, we should talk about Florida a little bit. Florida now frequently setting new records. As you can see, Florida set their single-day case record on Saturday with 21,683 new cases in one day. Florida has an aggressive spike going on. Florida also with record hospitalizations, and Florida's deaths also more than doubling. They had bottomed out at about 22, and they are now back up to 55, more than doubling deaths per day in Florida. So this is all happening. It is overwhelmingly the unvaccinated that are dying, and we know why that is. The vaccines, even though less effective in terms of preventing infection against the Delta variant, are still very effective in terms of preventing really serious cases and in particular deaths. So America number one, once again, from the standpoint of cases. Patrick Riley says, "Sir, I am positive Pastor Locke does not speak at that same volume to each of his family members all day long." Yeah, probably not. Probably not. I want to say thank you to Fendino as well as Amber Wamber, who says via Twitch Prime, "I don't wish harm on anyone, but anti-maskers and anti-vax people get on my nerves. I'm in rural West Virginia, not West Virginia, Virginia. And in order to protect my family from plague rats, we've kept to ourselves. Thank you for the COVID coverage." Thank you. Also, thanks to Shelegy for signing up via Twitch Prime, putting us at 11. You can take advantage today of a massive discount on my website, joinpacman.com. That code is MyHIPAA. It gets you 70% off. And as I've stated, if we get to 50, meaning we're only 39 away, we will play 3 rounds of a new game we've developed. Noam Chomsky or Bobby Fischer. Who said it? We have Chomsky and Fischer quotes. We will put up a quote. I have not seen these yet. I am playing the game as well as you are. And we will try to figure out who said it. Was it Chomsky or Fischer? It's just a joke. It's just because they, the beards. That's all it is. But I think it would be a really good game. And I'm told my team has put it together in a way that it actually will work really, really well. So we'll play that game if we get to 50. Phone lines open at 100. Let's listen to a couple of other voicemails before we get to some more things.
So I don't think it's that diet and exercise will prevent the infection or spread of disease. I think it's a disease caused by an infection.
Uh-huh.
So the way that nutrition is explained in personal training is that there are some foods which have like empty calories.
Mm-hmm.
Yes, for every story that you can find of a nurse who is anti-vaccine who you claim to have died of COVID, there are also news reports of people who were perfectly fine and then they had the vaccine and then they became ill and died. So
no, that is a lie. That is a lie.
Hello, David Packman. I'm calling in response to your video about Mr. Banks and Jim Jordan being denied on the committee because of Democrats. The reason is that you are pushing the big lie that Jim Jordan of Ohio, who has 100,000 more integrity than a person like yourself.
His integrity points are 100,000 more than me. He's also a level 72 mage.
Will not allow the Democrats to use this one-day event of confusion and use it as the Democrat Party wishes to, as a charade to smear.
Yeah, it's not even clear what he's talking about. These just come in all day and all night.
See, I don't understand how, like, men, like the recent man on your talk show, I don't understand how when men are talking about loonies or whatever, and they're like, well, I don't know how to deal with them, and I blow up, and, like, I swear, and, like, all this kind of stuff, and I don't know how to deal with them. And it's like, if there was a girl who said that, she would be, like, the loony.
I don't even know what that's about.
I feel like if men want to talk about normal in terms of, like, being able to communicate with, like, different people and stuff like that without swearing.
That's normal from the standpoint of communication.
Like, that's normal. Like, if somebody who's obviously crazy and obviously ill starts saying something and you start treating them like...
I just know these come in all night.
So I was wondering about Bernie Sanders as far as, like, how he targeted millionaires and now he's a millionaire.
Right. That's a really big issue.
But when it comes to Bernie, he's a stereotypical looking rich white dude. He does not look like a minority. And also, it's like, leave it up to a person like that who looks like that to discriminate.
Yeah.
So I was wondering if you could possibly find out, for political reasons, how much money goes into obesity? Like, out of all these, like, really extremely fat people with, like, all these obesity issues and health issues and stuff like that. Like,
Yeah, no, of course. I want to say thank you to VHS for sending... Oh, no, hold on. Let's see. Chris says, not politics, but curious. Have you ever had interest in learning another language? If so, which one? Yes, the language was English. I was interested in learning English. And when I moved to the U.S., I learned it. Spanish was my first language. English, my second language. I started learning French in middle school, and I have pretty good conversational French. And then I also have a little bit of Hebrew. And then Italian and Portuguese are just easy to understand because they're so similar to Spanish. At this point, not like when I went to Italy last, I just spoke Spanish and the other person spoke Italian slowly. And we could really understand each other just fine. It was not a problem. VHS says at this point, not getting vaccinated is like not paying your taxes. It's highly irresponsible. Yeah, well, the difference is not paying your taxes is illegal. Mike says, David, good news. Merck released a statement last week saying it's likely they will have an oral antiviral pill by the end of 21. Also, I'm not a spokesperson for Merck. Just wanted to tell you the news. Yeah, I figured. I think a real spokesperson for Merck would spell Merck correctly. But that is great news if true. Bay Photo says, according to CNN's Manu Raju, Graham was in attendance at a houseboat party hosted by Joe Manchin this weekend. Manchin went on some Sunday shows too. Yeah, maybe Manchin has it. Manchin, I think, was on a show along with AOC, like not at the same time, but they passed each other in the hallway. So Lindsey Graham's case seems to be getting very close to AOC. I want to say thank you to IICIWFN, Johnny503, as well as Lawful Waffle for signing up via Twitch Prime, numbers 12, 13, and 14. We will open the phone lines if we get to 100. The best way to support is always joinpacman.com. That's the place to do it. And you can use the coupon code MyHIPAA to get a big, big discount. Looks like there's a few people on the website clicking around, struggling to get the coupon codes working at this point in time. Okay. Let's continue and listen to a few more We are eventually going to get to voicemails from other people. We're just going through a lot of them from the same few callers, right? We're going in order, as I've promised.
Hey, David. I kind of just figured I'd just call you to tell you about something going on. It's relevant to your show in my family. I honestly don't know who else to talk to at this point right now, but my father has been sick recently, just suddenly sick. I can't remember the last time he was sick. And I said to my mother, well, sorry I'm talking loud, I'm a little upset, but I said, do you think it's COVID? And she said, well, I don't know, it's been a little while. I'm like, what do you mean? Like, well, a little over a week. I said, oh, well, thanks for telling me, because I come by here a lot to see
Dear
them,
God.
mostly to see my dad. And, well, they're Trump supporters, so they didn't get no dang vaccine. I got the vaccine. I'm not a Trump supporter, but they are, and they're not going to get that vaccine. They don't believe in it. And I am terrified because my dad is almost 70 years old. He's still working. He might have COVID. I am horrified that he might have COVID.
So you should
My
get
dad's
tested.
the only one I got in my family. He's the only one I really talk to.
Yeah. So that's a tough situation. That's a tough situation. Oh, it looks like then he called back.
Hi, David. It's Chuck again. I was a little upset earlier. I wasn't able to leave a good message, but just basically, like, my parents are both Trump supporters. They didn't get the vaccine. They didn't really. They weren't believing in COVID very much.
Yeah.
And now suddenly my dad is sick. I can't remember the last time he was.
It looks like he's going over the exact same stuff. Yeah. No. So that's not good.
I just think it's a really bad idea that we blame China, who's like has people enslaved. Like in general, I don't think that it's a good idea to blame Asians because of how many Asians are enslaved.
Yeah. Don't blame Asians. That's an interesting take.
I was thinking about standing up for myself against these transgender surgeries and that.
Yeah. Okay. Skip.
Exactly. Also, why don't you quit telling people what to do with their bodies? Who the hell do you think you are? You little cretin piece of worm to tell people that they have to do something. Who the hell do you think you are, you liberals, to try to mandate and force people to put this clinical trial junk garbage into their bodies? You are a slimy dirtbag human being.
Yeah, things are pretty backwards. We're trying to save people and we're the evil guys.
Again, David Packman, you only report on supposedly the people, and who knows if they even are dying of COVID, but anyone who's anti-vax that dies, you and the global corporate mainstream media are quick to report on it. But once again, you ignored the people who are dying, who are relatively healthy and were brainwashed or forced by their employer to take the vaccine, who are dying of the vaccine.
Yeah, that's not happening, unfortunately, for Troy's narrative.
Hello, this is Whitney. I was looking at this thing called List, and I didn't see you on there. It's like all these celebrities and stuff like that. They have books and stuff like that.
Yes, I'm not on Slist, whatever that is.
So I was thinking about to kind of like save our souls in general, to keep the focus on the environment as far as politics, because I'm feeling like anything like sexual related is taking like this really extreme like front and point and center.
Wow.
So one of the questions I had about the environment was how is it going to be progressive? Because
these are all voicemails coming every few minutes, just so people know.
So this is Whitney again. I really think that you should check out this app called Flist, F-L-I-I-S-T. I'm looking right now at Obama's reading list. It told me a lot about kind of like what was going on. He had a book on capitalism that he said really shined a light on the last year.
Ton of voicemails, huh? Yeah.
Big, massive dumps.
Maybe just like one more.
I was just thinking that we should elect Bernie because I feel like maybe his...
Oh, now she likes Bernie. The previous few voicemails back, Bernie was bad.
Skills could be a good attribute. just be like, I feel like he would be able to be used very versatility. I don't know if that's a word.
I don't think it is.
Mainly, I just want him to like...
Versatility is a word, but that's not the word she meant. Okay. All right. So we're going to move on from that. Yeah, maybe we'll get back to that. The White House press briefing has ended. So now the next up event is the COVID briefing. Very, very important stuff. I want to say thank you to Halibut Fish for subscribing with Twitch Prime. I really do appreciate that. You're number 15. And a big thank you. Wow. Jeff Hyatt signing up on my website with the code MyHIPAA. Jeff, thank you for signing up. You are new member number 16. The coupon code MyHIPAA. It does crazy things. Whatever you're lacking in your life, the code MyHIPAA will provide you. And as I mentioned, if we get to just 50, 100 is the big goal, and we should be able to do it. But if we just get to 50, I will play a few rounds of a new game we have, Chomsky or Fisher. No, who said it? The game is Who Said It? Noam Chomsky or Bobby Fischer. Now, just to preview it for you, okay? Here's a game, all right? Here's a quote. This is the way the game would work. It's an exclusive game. If I had a minute with George Bush, I'd ask him if he's talked to God lately. Who said that? Was it Noam Chomsky or was it Bobby Fischer? This is the gist of the game. If we were playing it right now, I would play a video clip and then we would all learn who said it. Okay. Now people are saying, oh, it's easy. It's easy. It's easy. I've been told the whole point of the game is set up not to be easy. Okay. So if people are interested in that, before we go on vacation and then we have to wait, 6 months before we play this game, today is a good day to do it. I want to say thanks to Jen here for gifting 2 subs via Twitch, putting us at 18. People seem to be liking the game. All right. A few other super chats coming in. Matthew says Fauci is going to announce mission accomplished and say COVID is over, right? Somehow I doubt it. Chris says, even if you don't watch it on stream, there's an amazing animated depiction of Sam Cedar and Crowder debate, Steven Crowder's Nightmare on YouTube. I did hear about that. Let's take a look at it. Steven Crowder's Nightmare. Let's see here. Yeah, here it is. Let's check it out. Just a little bit of this. Whoop, that's not it. Crowder's Nightmare. Here it is.
Okay. Right. All right, let me check this. Okay. All right, I'll give you a countdown and then I'll 3, 2. All right. Okay. I'm really glad to have my next guest on the show. And I've always said this. I always respect people who enter into the arena. And we've had a lot of debates on this show, which is different from like a Change My Mind where we sit down and have conversations. But I do appreciate the guy making the time because a lot of people haven't. You know him. Some of you like him. Some of you don't. Same can be said for me. Ethan Klein from H3H3. Ethan, thanks, man, for making the time.
You're very welcome. And I just want to say, I know you called me. You said that I would be a layup.
I think I used something like that. Yeah.
I think you're right because I don't think I'm a very good debater. I think you know that. So I didn't want to make it too easy for you.
Oh, okay.
So I've prepared.
Okay.
Yes.
All right. So what we were going to talk about is the initial quote that happened. I think he's looking off there.
Is Ethan supposed to be eating something during the thing? Anyway, you guys get the idea. And I'll leave the rest of it for you guys to watch on your own. But it's nicely done. It's very nicely done. I want to say a big thank you to Luke Nitschke. Luke just signed up on my website using the coupon code MyHIPAA, bringing us one closer to the Chomsky versus Bobby Fischer game. Very exciting, a game I would love to play with you today. Mindhack says, from the standpoint of massive dumps, what would you rate those voicemails? A lot of those are really low. Really, really, really low. Detonation says, sir, person, women, man, camera, TV. Exactly. Rohit Nair says, anti-science is far more dangerous than we probably realize. The arrogance of people not wanting to believe doctors and scientists is frightening. I'm doing a commentary tomorrow that's related to that. And I talk about that specific aspect, the arrogance of it. Very, very astutely said. And I completely agree with that. I also want to say thank you to Jacqueline Grant. Jacqueline, or Jackie, I don't know if you go by Jackie, has just signed up at joinpacman.com using the coupon code MyHIPAA, putting us at 20. That puts us 40% of the way to 50 and 20% of the way to 100 and 50% of the way to 40 and 67% of the way to 30. How relevant those calculations are, I don't know. But anyway, it's something people might enjoy. People asking for unban requests. I don't think I have any. Let me take a look. I didn't at the beginning of the stream. No unban requests today to adjudicate. I was actually not a math major. People I know thinking that I must be a math major based on those calculations. But no, I am not. All right, let's look at some generic voicemails, okay?
Thank you. I really love watching your program. I'm a born again Christian, and I'm in Indiana. Thank you so much.
Whoa, okay, that's not bad. I like that. That's not bad.
As a Scott in Cincinnati, apparently some good news. Though about 30 days, give or take rate, we have reached the 70% of Americans getting their first shot at minimum. And apparently CNN, I think it was, I saw a story, over 800K people. Sorry.
Yeah, so we've had 20 straight days of the average level of vaccination increasing from the standpoint of daily in the United States. That's a really good thing. I want to say thank you to KC Bates for the Twitch Prime sub, putting us at 21 today. Couple other, we're doing random. Okay, here we go.
Hi, David. Deborah from Portland, Oregon. I love your show. I always tell people about it. Question, what would it take to get somebody like Ron DeSantis out of office?
DeSantis.
Because clearly he is acting in an insane, irrational manner.
Yeah.
It seems like there has to be a way that people can remove him from office.
Yes, voting him out is the way to do it. That's really what it comes down to, quite frankly.
Hi, David. My name's Logan. I'm from Kenosha, Wisconsin. I was just wondering, what you think would happen if Trump ran as an independent?
I think he would lose, but he would take away enough votes from the Republican nominee such that the Democratic candidate would win.
Hey, David. I was wondering, how exactly is the Republican right wing that complains about cancel culture and how millennials are just snowflakes who've been coddled to, how are they any different? How is that depiction any different than what they are actually showing us with them taking the vaccine? Yeah, have a good day. Bye.
Did anybody understand that? I didn't understand that question. How is millennials and cancel culture and snowflakes being coddled different than the depiction that they're having the vaccine? Man, I don't know what that means. Let's listen. Let's try it once more.
Hey, David. I was wondering, how exactly is the Republican right wing that complains about cancel culture and how millennials are just snowflakes who've been coddled to, how are they any different? How is that depiction any different than what they are actually showing us with them taking the vaccine?
Oh, okay. So it's the idea that Republicans claim millennials are snowflakes who need to be coddled, but in reality, it is the anti-vax right-wingers who are really the snowflakes who need to be coddled because they don't want to get the vaccine. Is that what it is? I think I understand it.
Hey, David, I just want to get your take on this.
who do you think is a more dangerous group of people? Those who think the election was fraudulent, or COVID anti-vaxxers? I'll take my answer off the air. Thanks, Pack Dog.
That's tough. I don't know, because so if it were just beliefs, the anti-vax leads to them not getting vaccinated, and it allows COVID to continue to spread. Just believing the election was stolen doesn't really, it's not dangerous in itself, but then when they go out and riot, then it becomes dangerous. I think we're basically talking about the same people. So I don't know that we really even need to answer it in those terms. Johnny Minogue says, hi from the beach in Ocean City, New Jersey. Hope your vacation is fantastic. Thank you. I appreciate that. Couple other super chats, voicemails rather.
Hi, David. One of my favorite recent segments on your show was when you said that the problem in the United States is not that people can't agree on what are the facts. People can't agree on what facts are.
Right.
Or like what the word fact even means.
Yes.
What constitutes as a fact, and how is that different from something else? So I got to ask you, David, what is a fact?
Oh, God. Okay. Yeah, we're going to go.
Hi, David. This is Justin from Altoona, Pennsylvania. I watch your show all the time and subscribe on YouTube. I had a quick theory I wanted to run past you. Do you think that Marjorie Taylor Greene and Matt Gaetz are kind of doing damage control for Trump right now, where, they're going around trying to support the rioters to kind of save face for Trump so that...
No, I don't think so at all.
Hi, David. I had another suggestion I wanted to drop and see if you'd be interested in doing something on.
Please.
I know there was something about like you living in Brazil or living in South America at some point. And
oh my God.
I was curious about there's a branch of like Christians that developed in South America, a type of theology called liberation theology, and it was really condemned by like the Catholic Church and stuff for being like too socialist. And
yeah, I never lived in Brazil. I don't really know anything about that, but it's something I could make a phone call about.
Hi, David. Amy here, and I'd like to know if you could look into what's happened to the track and trace program. At the beginning, they were hiring lots of people to contact others when they'd come into contact with
forget about that.
someone with COVID. I haven't heard that mentioned in forever. If you could look into that and answer my question, I'd appreciate it. Thanks for doing what you do. Bye.
Yeah, I mean, it's just, don't forget about that. Forget, it's just not happening.
Yo, what's up, Pack Maniacs? Never Fall here. Just wanted to ask a question about people's views on abortion when astronomically it is in favor of brown people being aborted. So it's really easy to be like, I'm pro-abortion, but not really understand that.
Listen, even this framing is just weird. I've never met anyone in my life who's pro-abortion and that they want to get more abortions to happen. Okay. I've never, ever, ever in my life met anyone. Okay. So if you want to talk about abortion disproportionately being chosen by non-white people, before we even get to that conversation, nobody's pro-abortion. Should it be legal if that is what the mother in consultation with medical elements of medical decide that give me pro-abortion. Come on, guys. Give me a break.
Hey, good morning, David. My name is Carlos, out of Arizona. I'm calling just to talk to you a little bit about, the racism that exists in this country and kind of how a colored male, goes through this on a daily basis. Recently, I worked for a major retail, actually across the world, and had a customer who felt the need to express to me that I am a colored boy.
Oh my God.
I'm a grown man. I'm educated. I have a bachelor's. Some white male feels the need to demean me by calling me boy. Turn around and I respectfully approached him and told him, hey, don't ever speak to me this way. Don't ever call me boy again. Like, I don't know what makes you think you can refer to people that way.
Yeah, that's crazy.
This guy goes on a crazy rant, starts cussing at me, starts yelling at me, apparently addressing a white male to be respectful and just letting him know to not demean any employee within our company is being rude. He went as far as saying that I was being racist because I don't let someone speak to our employees and refer to them as boys.
Oh my God. Right. You were the racist for trying to control his speech. Yeah. Man, that's crazy. That's crazy. Are there any working coupon codes other than my HIPAA? I'm having trouble spelling it. Yeah. There are. Let's try. Here's a coupon code people might like. This is on my website. This is still probably my favorite coupon code. Indictment 21. There you go. That's a hell of a coupon code. Indictment 21. Oh, yeah. Immoral 21. Let's try that one. That one may work. Ooh, 6 extra cents, though. If you go with Indictment 21, that'll drop it from $1.86 to $1.80. That's an even better deal. I would go with that. Definitely. Very, very much so. Okay, a couple other super chats. Zach Foster says, I think most agree masks are a needed precaution in the meantime. There are a ton of confounders in the Massachusetts outbreak and odd to base guidance off of. Yeah, so we talked about this on the bonus show today. There's a lot of really wacky stuff. So for people who don't know, there was around the 4th of July, Provincetown, Massachusetts had an event called Bear Week, okay, which is like a big gay event. Oh, hold on a second. We'll get back to that.
And 1 in 3 cases nationwide occurred in Florida and Texas this past week. Dr. Walensky, from the start, we've known that this virus is unpredictable.
Oh my God, here we go.
That's why we spent the last 6 months preparing for every scenario. As a result, we have the tools we need to manage this. Most importantly, the tool that is most important is the highly effective vaccines.
Right.
We have enough vaccines for every American who wants one. They're free and they're easily accessible within 5 miles of 90% of where Americans live. And in just 6 months, we've already gotten 165 million Americans fully vaccinated, including 80% of seniors who are the most vulnerable. But we have much more work to do to put this pandemic behind us. There are still about 90 million eligible Americans who are unvaccinated, and we need them to do their part, roll up their sleeves and get vaccinated. Each and every shot matters. And last week, the president laid out several areas where we're taking additional steps to get more Americans vaccinated. We expanded the tax credit to help small and medium-sized businesses provide their employees paid time off to get themselves and also their families vaccinated. And we're working with school districts and pharmacies to bring vaccines to schools to make it as convenient as possible for students to get vaccinated. In the past 2 weeks, we've seen a 50% increase in the average number of 12 to 17-year-olds getting vaccinated each day.
Yes.
That's a very encouraging uptick.
Super strong.
We're also working with states to encourage vaccinations through incentives, which have made a difference throughout the vaccination effort.
Donate plasma
Last
today,
week,
please.
the president called on states and local governments to use funding they have received, including from the American Rescue Plan, to give $100 to anyone who gets fully vaccinated.
Oh, man.
Minnesota and New Mexico have already stepped up to answer the president's call. If financial incentives like these help us get more shots in arms, we should use them. But in addition to incentives, it's time to impose some requirements based on the realities of different risks.
Here we go.
Vaccinated individuals pose.
This is the announcement. Here we go.
Those who have been vaccinated.
Let's take some notes.
Last week, the Department of Veteran Affairs announced it will require doctors and nurses and other healthcare workers who provide medical care to our veterans to get vaccinated. This is in lockstep with many healthcare employers around the country who are requiring vaccinations and will protect our veterans when they get medical care. At the President's direction, the Department of Defense is looking into how and when they will add COVID-19 vaccination to the list of required vaccinations for the military.
Wow.
And to protect the federal workforce, their loved ones, and their communities, the President announced that every federal government employee will be asked to attest to their vaccination status. Any federal employee who does not attest or is not vaccinated will be required to mask no matter where they work, get tested once or twice a week,
Wow.
socially distance, and generally will not be allowed to travel for work.
Wow.
We're taking steps to apply similar standards to all federal contractors. It's simple.
What are those military dudes going to say when they're told you got to get vaccinated or you're out?
And the President has called on all employers around the country to protect their own workforces. And now we're seeing positive momentum across the private sector. The Chamber of Commerce, the National Association of Manufacturers, and the Business Roundtable have all applauded the actions we're taking. Companies like Google, Walmart, and Disney have announced vaccination requirements for their employees, joining hundreds of universities and hospital systems across the country who are implementing similar requirements.
Wow.
With these ongoing efforts, there's a strong sense of progress, and you see it in the number of shots we're getting into people's arms each day. Over the past few weeks, we've seen a nearly 70% increase in the average number of new people getting vaccinated each and every day. In the last 7 days alone, 3 million Americans have gotten their first shot. That's the highest 7-day total since July 4th. And just today, we hit 70% of adults with at least one shot, including 90% of seniors with at least one shot. These are significant milestones in our fight against the virus. And it's very important to note, in the states with the highest case rates, daily vaccination rates have more than doubled. The 8 states with the highest current case rates have seen an average increase of 171% in the number of people newly vaccinated each day over the past 3 weeks. Louisiana has seen a 302% increase in the average number of newly vaccinated per day. Mississippi, 250%.
Yeah, guys, it's weird. Like the military has had vaccine requirements for decades and decades. How is it all of a sudden illegal to include the COVID vaccine on that list? It doesn't pass the, where were you on the military anti-vax activism up until an hour ago?
Being unvaccinated and responding with action. And that's what it's going to take to get us out of this pandemic.
Right.
With that, let me turn it over to Dr. Walensky and Dr. Fauci.
Here we go.
Dr. Walensky first.
This is big.
Good afternoon. Let's begin with an overview of the data. As of Saturday, CDC reported the 7-day moving average of daily new COVID-19 cases to be about 72,000 cases per day.
Oh, man.
This represents an increase of 44% from the prior 7-day average and higher than our peak of last summer. The 7-day average of hospital admissions is about 6,200 per day, an increase of about 41% from the prior 7-day period.
Brutal.
And 7-day average daily deaths have also increased to 300 per day, an increase of more than 25% from the previous 7-day period. I want to start today by simply stating the obvious. While we desperately want to be done with this pandemic, COVID-19 is clearly not done with us, and so our battle must last a little longer. Many of us have lost loved ones or have been ill ourselves. All of us have given up things in our lives that we enjoy. This is hard, this is heavy, but we are in this together. And as we learn more about COVID, we continue to rely on proven ways to protect ourselves, our children, and our loved ones. I told you I would give you scientific information as I have it, when I have it. Here is what we have learned in the last 2 weeks about the Delta variant. First, the Delta variant is highly contagious. To put this in perspective, if you get sick with the Alpha variant, you could infect about 2 other unvaccinated people. If you get sick with the Delta variant, we estimate that you could infect about 5 other unvaccinated people, more than twice as many as the original strain. Second, infections with the Delta variant result in higher viral loads. This means that those who are infected have a larger burden of virus that they can spread to others. Third, those higher viral loads are seen not just in those who are unvaccinated and infected, but also and importantly in the small proportion of those who are vaccinated and become infected.
Whoa.
Last week, we published data on an outbreak in Barnstable County, Massachusetts, where there were 346 confirmed cases of COVID-19 in people who were fully vaccinated. During the summer, some towns in Barnstable County can have up to 240,000 visitors per month. Those with breakthrough infections had viral loads that were similar to people who were infected and unvaccinated. This new finding, combined with data from other outbreak investigations and surveillance studies across the country, was critical in our decision to update our guidance for those who are fully vaccinated. Since those data were released, several other studies have been released over just this past weekend that have corroborated these findings. Taken together, the Delta variant is different from prior strains. I understand this is all frustrating news, and I share this frustration. We continue to learn each day from emerging science and use this evidence to update our recommendations. Because of what we now know about the Delta variant and infections in those who are vaccinated, we updated our recommendations, including recommending masks in public indoor settings in areas with substantial and high transmission, shown in orange and red on this map. It is also the reason we continue to recommend universal indoor masking in K-12 schools throughout the country, so our children can safely get back to school and safely stay there. In all of this, there is still good news. Our vaccines are working to prevent severe illness, hospitalizations, and death. Vaccines are providing protection both for individuals and communities across the country. As I have said before, this remains a pandemic of the unvaccinated, where the vast majority of spread is in this country is among those who are unvaccinated. I want to be clear. While vaccinated people can spread the virus if they get a breakthrough infection, the odds of them getting sick in the first place are far lower than those who are unvaccinated. And in fact, places with more vaccination generally have less disease. We can see this on a population level on this slide, where we compare case counts and vaccination coverage by state, with vaccination coverage on the horizontal axis and case counts on the vertical axis. States with the highest vaccination coverage are the dots furthest to the right on the graph, and states with the highest case counts are the dots closest to the top. Notice that the states that have lower vaccination coverage, those further to the left, have higher rates of
She has to explain how to read this.
as shown in red and orange. States that have higher vaccination coverage further to the right have lower rates of cases as shown in yellow. There is a direct correlation with vaccine coverage and case rates. And I think it's worth reiterating that public health prevention strategies, including masks, continue to work while you're unvaccinated. In the following outbreaks of cases in Barnstable County and in subsequent public health follow-up, we saw the power of vaccines and masks. Over the month of July, there were a total of 934 confirmed cases of COVID-19 linked to the outbreak in Barnstable County. With 73% of these infections in people who were vaccinated, there were only 7 hospitalizations and no deaths. Our vaccines did exactly what they were supposed to do, prevent severe disease, hospitalization, and death. Furthermore, as cases increased, local public health officials implemented a package of public health prevention strategies, including increased testing, contact tracing, and indoor mask wearing. And within 2 weeks, test positivity fell from a peak of 15.1% to 4.6%. Public health prevention strategies work. Let me end by reiterating 3 things you need to know. First, our vaccines are working to prevent severe illness, hospitalization, and death.
A lot of people getting banned. A lot of people.
Vaccinated, please protect yourself and get vaccinated. Second, masks will protect you and your family. If you are in an area of substantial or high transmission, please wear a mask in public indoor settings, regardless of your vaccination status. And third, we need to keep our children safe and in school. Get everyone in your family over the age of 12 vaccinated, and please wear masks in school. Finally, we stand here with you, providing science and updated guidance in real time to keep you and your families safe. Thank you. I'll now turn it over to Dr. Fauci.
Thank you very much, Dr. Walensky. I'd like to take up on the theme that Dr. Walensky started with. If I could have the first slide, I'm going to be spending a couple of minutes addressing
Here we go.
issues that are very much on the attention of people throughout the country and the world. The first is, as Dr. Walensky mentioned, the real world effectiveness of vaccines in the context of the Delta variant, and second, breakthrough infections, what they mean, and let's discuss them a bit. Next slide. Let's look at the real world effectiveness against the Delta variant. If you look at the three components of PCR confirmed infection, it's 79% in a UK study. Symptomatic infection is 88%. And just as Dr. Walensky mentioned, the vaccines are doing exactly what we're asking them to do when it comes to keeping you out of the hospital, out of serious disease, and certainly preventing your death. Just a quick comment on the 79%. That may look a bit low, but remember, the efficacy of the clinical trials that were published by the trials that gave you something like 94 or 95% was against clinically apparent disease. What we're talking about here is just infection, so you would expect it to be a bit lower. This has important implications when you get into the discussion of what we call breakthrough infections. Next slide. Now, if you take these data and look at them across multiple countries, but ask the question, what does a full component of a Pfizer mRNA provide with regard to protection against Alpha versus Delta in three separate countries?
Important.
The data on the left are essentially the data I just showed you. Alpha now is in blue and Delta is in red. When you get to Canada, you see a similar protection against hospitalization, which is the area a bit to the right in that middle panel, compared to symptomatic disease.
Right.
When you get to Israel, you see what we now know from reports from Israel, that you see a diminution at around 64% for confirmed and symptomatic disease. This is likely due to the fact that Israel has started their vaccination program before the other countries. So you're seeing a little bit down the pike from the beginning. But note again, the 93% consistently showing protection against advanced disease. Next slide. Now, if you ask the question, what about the reduced risk of either symptomatic infection, hospitalization, or death when you compare vaccinated individuals with unvaccinated?
Perfect question.
What is the fold reduction when you're in red with unvaccinated versus in blue with full vaccinated?
Right.
As you can see, for disease itself, it's an 8-fold reduction. For hospitalization, 25-fold reduction. And for death, 25-fold reduction. Let's move on now to breakthrough infections. Just a couple of comments.
Super strong.
Pass this slide. Go to the next slide, please. The breakthrough infections, we have no vaccine is 100% effective. And so you can expect breakthrough infections. So even with a high vaccine effectiveness, most of these infections are going to be asymptomatic or mild. And we know that. We've already seen that from the experience in Massachusetts, in Provincetown, and we see it in all other situations. An important point to bring up is that the greater percentage of people that are vaccinated, even with a high degree of protection, the absolute number of breakthrough infections might appear high. That's not the critical number.
Right.
The critical number is what is the proportion of the vaccinated people who, in fact, are getting breakthrough infections.
Thank you.
And that's the critical one. The bottom line of what we are saying is that, next slide, get vaccinated. I say that every single time we all say it. The COVID vaccines give strong protection against the Delta variant, and it protects you, your family, and your community. Back to you, Jay.
Thank you, Dr. Fauci, and thank you, Dr. Walensky. As you both stated, it's never been more important to get vaccinated. That's how we stop the spread of the Delta variant, and each and every shot matters. And while we work to get more people vaccinated, the federal government is also helping states and communities respond to outbreaks. Since launching our COVID-19 surge teams, we've been working directly with 10 states to support their efforts to combat rising cases with federal assistance and support. Last week, we reiterated to all governors that we stand ready to help them in meeting this moment, whether that be through more testing, increasing treatments, vaccine access and uptake, or other state-specific needs. For example, in Missouri, CDC experts are on the ground providing epidemiology, data analysis, and other public health support. FEMA in Missouri is helping to expand ambulance capacity, and HHS and FEMA are helping the state address their hospital needs. We're working with states like North Carolina on mobile vaccination clinics and Tennessee on public health staffing. And the administration is doing extensive outreach in states like Wyoming and Arizona to encourage more physicians to use life-saving monoclonal antibody treatments. Those are really effective, and we need to deploy them more and more where they're needed. The bottom line is we're doing everything we can to help more Americans get vaccinated and to help states fight the spread in their communities. With that, let's take a few questions.
Here we go.
First question.
And a reminder, check something. Jeff, I want to just add one thing. One of the slides was deleted, a technical difficulty that I'd just like to spend maybe 15 seconds. Please. I think it's really important. When we talk, it was mistakenly deleted, and that's the reason why I skipped by that other slide. When you look at breakthrough infections, as I mentioned, they're expected and are usually asymptomatic. As of July 26, the CDC received 6,587 reports of breakthrough infections that resulted in hospitalization or death among 163 fully vaccinated million people. That is a percentage of 0.01% or less. And when you look at the breakthrough cases, the percent of breakthrough cases in multiple locations like DC and Virginia, the percent ranges from 0.26 to 0.03. So I'm sorry that was left out. The bottom line is they are rare, and they rarely result, not rarely, but unusually result in hospitalization or death. Thanks, Jeff.
Thank you, Dr. Fauci. Okay, first question, please.
Please keep your question to one question. We're very limited on time. Jeff Mason, Reuters.
Hi, thanks very much. Jeff, you said earlier that it was time to do to have requirements with relation to the vaccine, and then you went on to list basically what you said last week about the VA and DOD. Are there more requirements coming? Do you think that there should be more requirements coming? And can you respond broadly to the impression that you are playing down the breakthrough cases? Thank you.
Good. Well, I'll take the first part of the question, and then I'll turn to Dr. Fauci because he just talked about breakthrough cases. Jeff, as you know, in the federal government, we've now put forward a strong system that if you're vaccinated, you can come back to work as normal. If you're not vaccinated, there are quite strict rules that you need to follow around testing, social distancing, and masking. The Department of Veteran Affairs, as you said, is an example of a vaccine requirement for all of their caregivers to our veterans. The president has asked the Department of Defense to look into how they will add COVID to the list of mandatory vaccinations for our armed forces, how and when they would do that. We will be looking across the federal government in other areas that could require these types of mandates, if you will, for vaccination. At the same time, I think it's really encouraging that we're seeing the private sector follow. I mentioned Walmart, Disney, and Google all announcing vaccine requirements, and there's dozens of other companies that are doing these types of actions to protect their workers as they come back to work. Universities, other health systems. So, Jeff, I think you're going to see a continued increase in vaccination requirements as people bring employees back to work. Second question was around breakthrough. Dr. Fauci?
Yeah, I'm sorry. What was the exact question about breakthrough, Jeff? I missed that one. Jeff?
This is Jeff Zients. Jeff Mason was asking, are we downplaying in some way the number of breakthrough infections that are happening across the country?
No, we're actually not, Jeff Mason, that is. As I mentioned in the discussion, when you look at the numbers, the total absolute numbers, when you're dealing with a cohort that you're examining that has a very high percentage of people who are vaccinated or large numbers, by definition, even with a high degree of efficacy, you are going to see absolute numbers that are high. The critical issue is what is the relative number, the percent that I mentioned. And that's the reason why I apologize. I wanted to interject that slide that was left out to show you the lower percentage of people who are in that category.
Next question, please.
Cheryl Stolberg, New York Times.
Hi, thanks for doing this call. A lot of Americans remain very confused about the recommendations. They don't understand why vaccinated people need to start wearing masks again. They're confused about what this means for their children in schools. And I'm wondering if you think that your messaging has been clear enough to the public, and what, if anything, are you going to do to try to address the confusion and
didn't they just explain
maybe
that?
simplify things for ordinary Americans out there who don't follow every nuance of the
And the
science?
blinging, I mean, come on.
Yeah, thank you, Cheryl. So maybe I'll start with the children and say I think our guidance is very clear about where we should be in schools, and that is everyone who is in a K through 12 school in the fall should be masked. Everyone across the country, adults, children, vaccinated or unvaccinated, everyone should be masked. In terms of the question about guidance for vaccinated people wearing masks, there are two components to what we're trying to do here. One is we're trying to save lives with our vaccines, and they're working to do so, and that's terrific. What they weren't studied in the clinical trials as to whether they prevent transmission. Initially, they did with Alpha. Unfortunately, they no longer do with Delta. The good news is that the vaccines really do work to prevent getting sick. However, for those people who do get sick, we are suggesting, the data suggests that you could potentially transmit. And for that reason, we are suggesting both vaccinated and unvaccinated in areas of high disease burden, orange or red on the map, continue to wear masks so they don't bring disease home or to others who are unvaccinated.
Yeah, I would just add that from day one, the president said we would lead with science and facts, and that continues to be the approach. And CDC and our other health experts are doing just that, leading with science and facts. We never said...
What's annoying about them asking that question when it's been explained is it also suggests that it hasn't been explained. Like, because if it did, why would you ask the same question again?
Next question.
Let's go to Aaron Billups at Spectrum.
Hi, thanks so much for taking my question. I was wondering how much, if any, surveillance is being done to determine the amount of asymptomatic spread. Experts I've spoken to say not enough of this is happening. Also, to help people get a sense of how much protection previous COVID infections offer, that's something I heard a lot of people point to as a reason they don't need to be vaccinated. Is there any data on the number of people
there is data about that.
who had previous COVID infections and whether that offered them any protection?
Okay, Dr. Walensky first, and then Dr. Fauci.
Great. Yeah. So we have numerous cohort studies that are examining exactly that. So we have several cohorts, tens of thousands of people across the country, where some of them are actually doing weekly PCR testing. These are cohorts of essential workers and healthcare workers. So we can actually examine how much disease is occurring in people who might be asymptomatic. That is the best epidemiologic way to study exactly that question.
Dr. Fauci?
Yeah, with regard to the second question, that if you're dealing with the same variant, if you get infected with an alpha variant or another variant, and that you recover from that, you are pretty well protected for a reasonable period of time from reinfection. It isn't perfect, but it's good protection. You can't doubt that. The situation changes when you're dealing with the evolution of a new variant, such as the Delta variant. And what we are seeing right now, that there are reinfections. The protection you get from the original infection still exists somewhat, but reinfections occur at a much greater rate among individuals now than we did against the original alpha. So bottom line is, when you're dealing with a variant, you don't get the kind of protection that you would have hoped to have gotten from a previous infection. Regarding the issue of vaccinating people, there's no doubt when you vaccinate someone who has had an original infection and who's recovered, not only do you increase the depth of the protection, not only do you increase the duration, but you also increase the breadth of it so that you cover not only the original, but the variants. And that's the reason why the recommendation still holds, that even though you've been infected previously, in the context of variants, it's a good idea to get vaccinated anyway.
Next question.
Go to Rachel Kors at Stat News.
Hi there. I had a question for Director Walensky about, whether the CDC is tracking COVID-19 booster shots that may be authorized by physicians.
Thank you for that question, Rachel. We are just starting to gather data and get data on, and we can discern between people who have gotten second and third shots. We are trying hard to encourage people to report on the safety side. If people have taken the initiative to get their third shot, again, not yet recommended, but we have the capacity and are looking at those data right now.
Wow.
Dr. Fauci, anything to add there?
No, nothing to add. She said it very well.
Next question.
All right, we got to do last question. Let's go to Zeke at AP.
Thank you all for doing this. I'm just following up on Jeff Mason's question earlier for you, Jeff Zients, on the additional requirements. It seems what you're trying to do here is impose some sort of cost on people who are unvaccinated as a sort of the stick there to sort of get them to roll up their sleeves and get the shot. So why isn't the federal government going further on some of these, whether it be proposing mandating vaccination requirements for travel across the federal workforce, for instance? How far is the administration willing to go to sort of turn up the pressure on the unvaccinated to actually get shots?
Well, Zeke, I think we've taken significant steps here to make it difficult to come back to work, or more difficult to come back to work if you're not vaccinated. There's so many reasons to get vaccinated that we've talked about to protect yourself and to protect your loved ones. And it's also a really straightforward way to return to work. So for all federal employees, the path back to work, if you're vaccinated, is straightforward. If you're not vaccinated, or you're not willing to attest to being vaccinated, then we're doing the right thing to protect the workforce, to protect the individual, their family, and their colleagues, which is rigorous testing, social distancing, and masking. There are mandates at the VA for vaccination for their healthcare workers, their doctors, and their nurses and other healthcare providers who take care of our veterans. That's consistent with a lot of health systems across the country and a growing number of health systems that are requiring vaccination for their healthcare workers who are on the front lines. As I said earlier, the Department of Defense is looking into how and when they'll add COVID to the list of mandatory vaccinations for active duty military. At the same time, we will continue to look across the federal government at other areas where requiring vaccines, everyone be vaccinated, may make sense, particularly in the healthcare setting. And we're seeing it in the private sector. More and more companies are coming up with systems that are modeled after our system or similar to our system, or requiring vaccinations across the board. You're seeing it at universities, you're seeing it at health systems. So I think that this requiring of individuals to be vaccinated in order to come back to work or to go back to school is a growing trend and makes a lot of sense given that we're going to beat this pandemic by getting more and more people vaccinated. I want to thank everybody for today. I look forward to the next briefing. Thank you.
So that's certainly very, very different than when Trump used to do these.
And then I see the disinfectant. Is there a way we can do something like that by injection inside? Or supposing we hit the body with a tremendous, very powerful light, apply light and heat to cure. Supposing you brought the light inside the body.
Yeah, we bringing the light in. All right, so very, very good. And I think that very important briefing here. I'm glad that it was done. Let's, I still have other things. So many people signed up during this. I want to thank everybody on my website. Jennifer Emery became a new member. Juan Morales is a new member. Kelly Cole signed up. Darlene Limpert, as well as Mitchell Dunn and Jean Torres. Steve Barnett and Angela Slawney. Want to say thanks to Sanford Wilcox as well as Wednesday Adams. Love it, putting us at 33. Over on Twitch, new Twitch Prime subscriptions from Texas Bearclaw, Dino Sorcal, Richard Eggle, Dan's News, Amraki gifted a sub, Snehal gifted a sub, Xavier signed up, Sobe signed up, Queen, Sweet Thang, and Chief Boris, putting us at 40. Wow. Now, I said I had a game to play if we got to 50 called Noam Chomsky versus Bobby Fischer. We didn't get there, but this is such a great game that I'm going to actually jump in and play a couple rounds of the game. I'm going to take it on faith that 10 more people are going to sign up. Drop in those Twitch subs. Get that joinpacman.com subscription. You can use the coupon code MyHIPAA to save 70%. Just do it. Just do it. Okay, let's try this game out. The game is called Noam Chomsky or Bobby Fischer. We are going to put a quote up on the screen, and we have to guess, was it Noam Chomsky or Bobby Fischer? And then we will look at the video. First one, if I had a minute with George Bush, I'd ask him if he's talked to God lately. So I think certainly it would strike me as this being a Bobby Fischer quote, but maybe that's the trick. Maybe it's actually a Noam Chomsky quote, because I could imagine George W. Bush claiming that God did this for him and God told him that and God told him to go to Iraq. And maybe it's a political reference from Noam Chomsky. So although I think it's obvious that it should be Fischer, I think that it's Noam Chomsky. Okay, let's now pull up the video clip and see who it was. Okay. Uh-oh. Uh-oh.
1 minute with George W. Bush. What would you say beginning now?
Exactly the role that George Bush plays in this is very dubious, questionable. In some cases, like say Ronald Reagan, he probably didn't even know what the policies were. He was reading off his note cards or the teleprompter or something like that. And Bush may have some knowledge of them, but I think he's mostly a ceremonial figure, trained to act in certain ways and so on. So if I had a minute with him, I would say, have you talked to God lately or something like that?
There it is. So first round is Noam Chomsky. All right. Very well. The game's working pretty well so far, guys, I have to say. I do want to say thanks to a Danish joint, Bionic Keyboard, The Div, and 2 gifted subs from Jen here, putting us at 45. I think we're going to get there. Looks like there's 5 people also in process of signing up on my website. All right, let's go to the next one. Was it Noam Chomsky who said it, or was it Bobby Fischer who said it? I don't think they should mess in the intellectual affairs. You know what I mean? They should keep strictly to the home, stay in the house cleaning things. They should just be at home waiting for the man to come home, and that's all. This has to be Bobby Fischer, right? I mean, there's no way that this is Chomsky. People seem to say it was Bobby Fischer. That's my guess. All right, let's look at it. So far, I'm 1 of 1. Many people in chat wrong on that first one. Here we go.
Well, I don't think they should mess in intellectual affairs, you know what I mean? You should keep strictly to the home.
A woman's place is over the hot stove, eh?
No, they can't cook, but they stay in the house cleaning and things.
Well, what can they do?
Well, you know. It should just be at home, waiting for the man to come home. And that's all.
Wow. So that was Bobby Fischer, rightly guessed. The game is Noam Chomsky or Bobby Fischer. Just because they have similar beards, we're not saying they're similar in any way. It's just a game, guys, okay? It's just a game. Here's the last one. It's time to finish off the United States once and for all. Death to President Bush, I say. Death to the United States. Okay. This strikes me as something that Fisher would say. It doesn't strike me as something that Noam Chomsky would say. That's my guess. People in chat seem to mostly think that that's probably a Bobby Fischer quote. Oh, I want to say thanks to Fearside for the Twitch Prime sub number 46. All right, people saying it is definitely Bobby Fischer. Let's take a look. Here we go.
This is all wonderful news. It's time for the U.S. to get their heads kicked in. It's time to finish off the U.S. once and for all.
Yep.
Death to President Bush, I say. Death to the United States. United States, the Jews. The Jews are criminal people. They mutilate their children. They're murderous, criminal, thieving, lying bastards. They made up the Holocaust. There's not a word of truth to it.
Not only was Bobby Fischer an anti-Semitic conspiracy theorist, I'm pretty sure he was also Jewish. I think his mom was Jewish. So that's the game, guys. I have more of these, but those were the 3 I was going to go over now. I want to say thanks to Hate to Lose 112, who is number 47 today. We have more, but we're gonna play them again in the future. We're gonna play them again in the future because I don't want to use all of them today. But that's the game: Noam Chomsky or Bobby Fischer. Bobby Fischer was completely out of his mind. Also, thanks to Hate to Lose 112 for 5 gifted subscriptions via Twitch Prime. I really do appreciate that. Really, really strongly. Very, very strong. All right, guys, thank you for joining me today. I will make every effort to stream tomorrow. That will be my last stream for a little while because I'm going to be on vacation. We will have guest hosts, Farron Cousins and Jesse Dollamore. But I will look to see folks again tomorrow. All right. Thank you very much for joining me.